So I'm Claire Glenton from the Western Norway University of Applied Sciences, and like Miriam, also extremely good experiences of working with HIFA and with Neil. The mHealth-Innovate project, it's a research project. The focus is to explore healthcare workers' informal use of mobile phones. So actually came out of a WHO guideline looking at formal digital strategies, and the sort of side conversations going on during the guideline was a lot of anecdote about healthcare workers sort of plugging the gap using their own personal phones. So we knew this was going on, but it was a very unexplored topic in the research. We weren't really finding any sort of data on it. So we got research funding, and as Neil said, HIFA was involved in the application for this research. And we wanted to use the research to explore what was going on with people's personal phones and possible benefits and harms. But as I said, this was an unexplored topic, sort of at least in writing, so we needed input from communities of practice. Next slide, please. So the first thing we did very early on in the project was to start a HIFA online discussion, or rather Neil organised an online discussion. And the aim of that discussion was really to sort of explore the topic, check that we were asking the right questions, and help define key concepts like informal mobile phone use. What did we even mean by informal mobile phone use? So that online discussion led us to revise slightly what we were planning on doing and revise our concepts. And that led to a publication where we described the results of the online discussion and where both members of the research team and HIFA members were involved in that publication. So we then used sort of the output from those discussions in the systematic review that we did and the quality research we did as part of the project. And then as the publications have come through the project, we're also using HIFA to disseminate our research publications. And then finally, the final sort of part of the project, which is ending this year, is to take all of the research we've done and have a new online discussion where we present the research and ask people, okay, so what next? What do we do with this information, and what should be the way forward? How do we keep the benefits we found and try and get rid of the disadvantages we've identified? Next slide, please. So in summary, I think I can echo a lot of what Miriam was saying, but from a sort of research perspective, what we found is that this is a really useful supplement to much more sort of formal research processes. They're often slow, they're often shaped by the researcher, and they're often limited to specific settings. In our case, the setting was Uganda, but the HIFA opportunity, if you like, allowed us to discuss topics quickly. I mean, almost as soon as we decided we wanted to run an online discussion, things went very quickly. We had access to relevant stakeholders, healthcare workers, managers, policymakers from a lot more settings than were involved in the research project itself. And it was a sort of informal opportunity to allow people to have a conversation on their own terms, if you like, and not sort of focused or led by the researchers.